Dr. Emily Carter looked at a patient not long ago who smiled and said, "Doctor, I use baking soda to keep my refrigerator fresh, but I can't imagine it has anything to do with my health." That simple comment reminded me how many older men overlook something that's already sitting in their kitchen. While baking soda is certainly not a miracle cure and it can't replace medical treatment, understanding what it can and cannot do may help you make smarter choices for your health after 60. Some of the benefits you've probably heard about are true. Others are misunderstood, and a few may surprise you because they're backed by basic science rather than internet myths. By the end of this conversation, you'll know where baking soda may be helpful, where you should be careful, and why men with certain health conditions should never use it without talking to their doctor first. My name is Dr. Emily Carter, and for the past 20 years, I've had the privilege of helping thousands of men better understand their health, confidence, and vitality. Every day, I care for older men who want simple, practical ways to stay active and feel their best without falling for exaggerated health claims. Before we continue, I'd really appreciate it if you take a moment to like this video, subscribe to the channel for trustworthy men's health advice, and leave a comment telling me where you're watching from. I'd also love to know this. What's one health tip you've heard about baking soda that you've never been sure was actually true? Now let's begin with one of the biggest surprises. Most people think baking soda only belongs in the kitchen, but inside your body, maintaining the right balance between acids and bases is part of keeping many systems working normally. Your lungs and kidneys do most of this work automatically. Baking soda, also called sodium bicarbonate, can temporarily neutralize stomach acid, which is why it's been used for generations as an occasional antacid. Think of your stomach like a fireplace. The fire is supposed to burn hot enough to do its job, but sometimes it flares up too much and sends sparks where they don't belong. Baking soda can briefly calm that excess acid, giving relief from occasional heartburn or acid indigestion. That sounds simple, but here's where many men make a mistake. They assume that if a little helps, more must be better. That's simply not true. Using baking soda too often can upset your body's normal balance, increase your sodium intake, and even interact with certain medications. Men with high blood pressure, heart failure, kidney disease, or those on sodium-restricted diets should be especially cautious. Organizations like the Mayo Clinic and the National Institutes of Health consistently remind us that home remedies should never replace proper medical evaluation when symptoms keep coming back. But that's only part of the story. Another interesting area involves physical activity and muscle fatigue. As we age, many men notice they tire more quickly during exercise. Scientists have studied whether sodium bicarbonate can help athletes during short bursts of intense activity by buffering some of the acid that builds up in muscles. Imagine your muscles as the engine in your favorite pickup truck. During a steep climb, heat builds up inside the engine. If that heat isn't managed well, performance drops. In a similar way, certain intense activities produce byproducts that contribute to fatigue. Under carefully controlled conditions, baking soda may help delay that feeling for some athletes. Now, before you rush into trying it, there's an important difference between elite sports research and everyday life. The amounts studied are carefully measured, and they often cause stomach discomfort, bloating, or diarrhea. For most men over 60, staying active through regular walking, strength training, stretching, and good nutrition will do far more for long-term health than experimenting with baking soda before a workout. What comes next surprises most men because it has nothing to do with exercise or heartburn. It involves something nearly everyone notices as they get older: oral health. Healthy teeth and gums aren't just about having a nice smile. Poor oral health has been linked with heart disease, diabetes, and other chronic conditions. Because baking soda is mildly abrasive, it's commonly found in many toothpastes. It helps remove surface stains and freshen breath without being as harsh as some stronger abrasives. Think of it like gently polishing a favorite pair of leather shoes. Done properly, you improve the appearance without damaging the material. Still, brushing technique matters much more than the ingredient itself. Gentle brushing twice a day, regular dental visits, and flossing remain the real foundation of good oral health. Baking soda isn't magic, but it can be one useful tool when used appropriately in products designed for dental care. And the next benefit may be even more important, because it helps explain why understanding the difference between evidence and myths can protect both your health and your wallet. One of the biggest myths I hear from older men is that baking soda can clean out the entire body or somehow cure almost any illness by making the body more alkaline. I understand why that idea sounds appealing. We all want a simple answer to staying healthy, but your body is far more intelligent than that. Think of your bloodstream like the water system in a city. It has to stay within a very narrow range for every home to receive clean, safe water. Your body works the same way. Your lungs, kidneys, and other organs constantly adjust your acid-base balance. If that balance changes too much, it becomes a medical emergency. Drinking baking soda cannot safely reset your entire body, and using large amounts in hopes of doing so can actually be dangerous. This is why trusted organizations such as Harvard Medical School and the Cleveland Clinic encourage focusing on habits that truly support your body's natural systems. Eating more fruits and vegetables, staying hydrated, getting enough sleep, and remaining physically active do far more for long-term health than chasing internet shortcuts. But here's what most men never realize. One of the most valuable things baking soda can do has nothing to do with miracle cures. It can help you become a more thoughtful consumer. Whenever you hear claims that one inexpensive household ingredient can cure arthritis, diabetes, cancer, prostate enlargement, or low testosterone, that's your signal to pause and ask questions. Real medicine rarely works that way. Let's talk about another practical benefit that often gets overlooked. Many men notice itchy skin or irritation after working in the yard, exercising, or spending time in hot weather. A baking soda bath may provide temporary relief for mild skin irritation or itching in some situations because it can soothe the surface of the skin. Picture your skin like the protective paint on your home. When dirt, sweat, and irritation build up, the surface becomes uncomfortable. A gentle soak may help calm that irritation for a short time. But if you have an infection, an open wound, a spreading rash, or severe itching that doesn't improve, baking soda isn't the answer. That's a sign to see your healthcare provider instead of trying to solve the problem at home. Stay with me because this changes everything. As men get older, many also become more concerned about kidney health. You may have seen headlines suggesting baking soda protects the kidneys. There is some truth here, but the details matter. Certain patients with chronic kidney disease are sometimes prescribed sodium bicarbonate by their physician to help manage a specific medical condition called metabolic acidosis. This is not the same as buying baking soda at the grocery store and treating yourself. The dose is carefully calculated, blood tests are monitored, and the treatment is adjusted over time. Think of it like adding oil to a car engine. The right amount, used for the right reason, helps the engine perform properly. Too much, too little, or adding it when the engine doesn't need it can create new problems instead of solving old ones. This is an important reminder that medical treatment should always be personalized. What helps one patient may be harmful to another. That's especially true for men with kidney disease, heart disease, high blood pressure, or those taking prescription medications. Another surprising benefit is something many men appreciate every single day: reducing unpleasant odors around the home. While this isn't a direct health benefit, a cleaner environment can certainly make daily life more comfortable. Baking soda is excellent at absorbing certain odors in shoes, refrigerators, gym bags, and other places where smells tend to build up. It reminds us that healthy aging isn't only about medications or medical tests. Sometimes it's about creating an environment that encourages good habits, reduces stress, and makes you feel better in your own home. But the final points are even more important because they focus on what baking soda cannot do. And knowing those limits may protect your health far more than believing exaggerated promises. The last few benefits aren't really about what baking soda adds to your life. They're about the mistakes it can help you avoid. For example, some men begin experiencing frequent heartburn and simply keep reaching for baking soda week after week. The temporary relief makes them feel like the problem has been solved. But recurring heartburn can sometimes point to acid reflux disease, stomach ulcers, certain medications, or other conditions that deserve medical attention. Covering up symptoms without finding the cause is a little like putting a towel under a leaking pipe instead of repairing the pipe itself. The water may disappear for a while, but the damage continues behind the wall. Another common misunderstanding involves testosterone, prostate health, and sexual performance. I often see online posts claiming that baking soda boosts testosterone, shrinks the prostate, or restores erections. At this time, there is no strong clinical evidence to support those claims. Healthy testosterone levels and good sexual function depend on many factors, including sleep, exercise, body weight, blood vessel health, blood sugar control, stress, and certain medications. If you're struggling with low energy, urinary symptoms, or erectile dysfunction, the best step is a proper medical evaluation, rather than relying on an internet remedy. Think of your body as a well-maintained garden. You don't create a healthy garden by watering just one plant. You care for the soil, provide sunlight, remove weeds, and stay consistent. Your health works the same way. Small daily habits build on each other over time. That brings us to the 10th and perhaps most valuable benefit of baking soda. It reminds us that simple things can be useful when they're used wisely. Baking soda has earned its place as an occasional antacid, a common ingredient in oral care products, a gentle option for some minor skin irritation, and a physician-guided treatment for specific medical conditions. Those are real benefits, but it is not a cure-all, and respecting its limits is just as important as understanding its uses. The American Urological Association, the Mayo Clinic, and other respected medical organizations continue to emphasize that healthy aging is built on proven habits. Eat a balanced diet rich in whole foods, stay physically active, keep your blood pressure and blood sugar under control, get enough sleep, stay connected with family and friends, schedule regular checkups, especially if you're over 60. Those habits may not sound exciting, but they consistently outperform quick fixes when it comes to protecting your health and independence. If there's one message I'd like you to remember from today's conversation, it's this. Don't underestimate simple tools, but don't expect them to do extraordinary things they were never meant to do. Baking soda can be helpful in the right situation, in the right amount, and for the right reason. Knowing the difference is what keeps you safe. Small daily habits create long-term health. The choices you make today, whether it's taking a walk, drinking enough water, brushing your teeth, eating a nutritious meal, or asking your doctor about a symptom you've been ignoring, can add up to meaningful improvements over the months and years ahead. You don't have to change everything overnight. Just keep taking one healthy step after another. If you found this video helpful, please like it. Subscribe to the channel for more evidence-based men's health advice, and leave a comment sharing your experience or any questions you'd like me to answer in a future video. I always enjoy hearing from you, and your comments help shape the topics we discuss next. Thank you for spending these few minutes with me. Take good care of yourself, stay curious about your health, and remember that you're never too old to make choices that help you feel stronger, healthier, and more confident. I look forward to seeing you in the next video.